Hi, everyone, and welcome to today's webinar, Returning to Work During COVID-19. I'm sure this is very timely for many of us, and before we jump into the best practices and things to consider, I want to go over just a few logistics. So first, the webinar will be recorded, and we'll send out a follow-up email with access to the video after today's session. Also, we have enabled the question feature on the right-hand side of your GoToWebinar panel. So if you click on the gray questions tab to type in your questions, you can do that at any time, and we will have time for those at the end of the presentation. So I am Hannah Curtis. I'm a coordinator with the North Metro SBDC, and I'm so happy to introduce our presenter today, Courtney Berg. Courtney is the owner of CourtSide Consulting and has over 30 years of HR and operations experience and is an HR consultant for our North Metro SBDC office. So we feel so lucky to have Courtney's expertise today on this issue. And Courtney, I will turn it over to you now.
Well, thank you so much, Hannah. It's so nice to be here. I wanted to thank the North Metro SBDC for asking me to present on such an important topic. Welcome to Returning to Work during COVID-19. The purpose of this course is to really help business owners as they bring their employees back on site, or maybe they're on site, but you still have some questions about if you're following the right processes or what processes to follow. Hopefully this webinar will really help you with all of those questions. I know that everyone wants to bring back their employees safely during this pandemic, and the information in this course is designed to help you do that. So one disclaimer I want to make before we get started today, and that is that the COVID-19 information is changing almost daily. So the information in this course is current as of the recording of this webinar. However, the information can come to light that is in this course that maybe they've changed the way they're thinking, or they've changed a process, or the CDC is recommending something different. So be sure to check with the CDC, OSHA, and even local health department and industry standards resources for the latest information before you make a change to your policy. So what are we going to talk about today? We're going to be talking about the resources that you can use when deciding what to do as your employees return to work, or as you want to make sure that everything's in order as they're at work. We want to help you identify actions to take to keep employees as safe as possible. And we want you to be able to describe what needs to happen if an employee is exposed to or showing symptoms of COVID-19 at work. So those are the three main things that we're going to be talking about today. So let's move right into resources. There are many resources available through the Small Business Administration, the Centers for Disease Control, OSHA, local health departments, and of course the North Metro SBDC. So when you're looking for these types of resources, we're finding that they come under various titles. The SBA, if you're looking for things from the SBA, you can search COVID-19 resources for small business. And when you do that, you're going to find a plethora of information and resources put together by the SBA. The CDC has a lot of information as well, as you might imagine, and you can search for interim guidance for business and employers responding to the coronavirus. So the interim guidance for businesses and employers responding to coronavirus is something you can search for there. And then for OSHA, it's just simply guidance on returning to work. And so those are some really powerful resources for you. They have increased the information there almost daily. They're adding things to it or making adjustments or edits. So a great thing to bookmark in your search engine, just to be able to go there and see what the updates are. So I want to talk a little bit about CDC guidelines, but we're going to go through the OSHA guidelines at some length, just to make sure that you've got those policies and procedures and checklists and those kinds of things in order for your business. Now, the CDC guidelines are similar to OSHA's. Conduct daily health screenings with your employees, conduct a hazard assessment of the workplace, encourage employees to wear face masks, implement policies and practices for social distancing, and improve building ventilation. And we're going to talk about all of those different areas, but I'm going to talk about them from OSHA's standpoint. So I want to spend a little bit more time on OSHA's guidelines today. And so what are those guidelines? Well, they're similar to what we were talking about before, and I'm going to cover all of these guidelines in greater detail in the presentation. But here is just a general list of the OSHA guidelines. So hazard assessment, that's really looking at where, when, and how are employees likely to be exposed to the coronavirus in the course of their job duties. And again, we'll talk more about that in just a few minutes. Hygiene, the practices for hand hygiene, respiratory etiquette, cleaning and disinfecting the workspace, those types of things. Social distancing includes maximizing, to the extent possible, obviously, that 6-foot distance between all people. And that would include your employees, your customers, and any visitors to your work site. Identification and isolation of sick employees. This is actually what I get questions on, and honestly, it makes small business owners nervous. So we are going to be covering this, and this would include worker self-monitoring or screening, and then isolating and excluding any employee with signs and symptoms of COVID-19 once they come to you and say, hey, I think I'm sick, and they're at work. So what do you need to do? We're going to go into that in great detail. Return to work after an illness or exposure. So those employees who are completely recovered or maybe have been in quarantine because they were exposed, and so they've been in quarantine for the required period of time and now they're returning to work. How do you handle that situation? Controls, and the controls have to do with personal protective equipment or PPE, workplace safety practices, maybe something that resulted from the hazard assessment that you did. So we'll talk about that. Workplace flexibilities deals with those things that maybe you put into place that concern remote work or sick leave policies. You may have read that Colorado has a new sick leave policy that is in effect that has to do specifically with the COVID virus between now and December 31st. And then there's also going to be paid sick leave that's required from small businesses over the course of the next 2 years. And so we'll talk about that as well today. Training, just ensuring that all your employees are receiving training on the signs, symptoms, and the risk factors of COVID-19. And then one of the things that I think is extremely important and not talked about enough is that anti-retaliation policy and ensuring that no retaliatory action is being taken against an employee who is adhering to guidelines or raises workplace safety and health concerns or returns after having an illness or an exposure. So we'll go into that a little bit as well. So buckle up. We're going to get a lot of information over the next few minutes, and I'm really glad that you're joining me today. So again, we'll take questions at the end, but please be sure and put those questions into the question box as you get them, as they come to your mind, so you don't forget about them, and we make sure that we're recording those and we can answer those at the end. All right, let's talk about the OSHA guidelines with regard to hazard assessment. The hazard assessment helps you determine possible risks of exposure in your workplace. So you're assessing when, where, and how an employee might be exposed to COVID-19 when they are on the job. You want to look at job descriptions, all the job tasks or functions that employee has, and consider which tasks or which assignments that you might give the employee could lead to them being exposed to COVID-19. Now you can do this virtually to maintain social distancing. So if you have remote workers, you can actually have conversations with them if they're going out and meeting with people, or if they're coming to the office soon or whatever. You can actually have that virtual meeting with them. If they're at the office, of course, you want to make sure that you're maintaining social distancing and everybody's wearing a face mask, so you're doing that safely. But you want to have those conversations around those activities that employer, that employee, could be exposed to. So consider customers and visitors when they come to your on-site location, as well as coworkers. Look at any kind of exposure that they may have. And also consider current conditions within the community. So these are some of the stats that we're seeing. The governor has a new press conference almost daily, if not daily, that talk about the community and what the numbers are looking like. You can also get localized numbers through the internet. to see what's going on in your community and if the spread is increasing or if it's decreasing, or any statistics there that might be relative to the employee and their workplace. So hygiene is something that we hear about a lot. You know, let's wash our hands, let's use hand sanitizer, those types of things. As an employer, we want to make sure that we provide soap and water and paper towels for employees, customers, and visitors, and encourage the employees to frequently and properly wash their hands. Properly washing hands means washing them with soap and warm water for at least 20 seconds. So some people sing a song, some people count to 20, whatever that might be, but make sure that they're doing that proper hand washing to decrease the spread within the workplace. Also provide hand sanitizer, and that could be put out in multiple locations across your work site, just to make sure that everybody has access to it. So common areas, you know, break areas, maybe where your copier is, or other areas where employees might congregate. You want to make sure that that hand sanitizer has at least 60% alcohol. And just encourage workers to use it frequently when they cannot wash hands. Also put it out in your reception area so that your guests and visitors and vendors can also have access to that particular hand sanitizer and feel comfortable using it. And then make sure that you're targeting the high traffic areas for enhanced cleaning and disinfecting using EPA registered disinfectants and obviously the CDC guidelines to control the spread of Corona-19. So, I'm sorry, the coronavirus. So what you want to do is you want to actually talk to your employees and make sure that they're doing that train them on how to properly clean the areas, when to clean it, and follow up with them to make sure that they're doing that. So the OSHA guidelines on social distancing talks about limiting the number of people in the building or the space to the max that can easily stay socially distanced. So, you know, that's that 6-foot zone in between people. You want to maybe mark the floors. You'll see this in some stores that you go into or businesses that you go into. They'll have marks on the floor as far as 6 feet zones in those key areas where employees or customers or visitors would normally congregate. So it could be bathrooms, checkout lines, those kinds of things. You want to make sure that you're having tape on the floor, some kind of mark on the floor that's easily seen so people know how far apart to stand. And then encourage people to stay 6 feet apart from each other while they're in their office. So, you know, you can have signs that remind people to stay 6 feet apart. You could post directional signage in areas that are tight and limits proper social distancing. So maybe aisles in a retail store or something like that, where you have one-way aisles, so people are all walking the same way and then keeping 6 feet apart. So a lot of this is they're self-managing. You know, they're your visitors, your customers, your employees are self-managing that social distancing. But as an employer, we need to make sure that our employees are trained on how to have conversations with customers if they're too close. And we also need to make sure that our employees are staying apart. So work with them on that. So here's where it starts to get a little dicey with some business owners, and that is the identification and isolation of sick employees. So one of the first things you want to do when you have everybody coming back to work is you want to talk to the employees about self-evaluation for signs and symptoms of COVID-19 before they leave home to come to work. And so you want to make sure that they understand what those signs and symptoms are, and we'll be going over those in a little bit. But you want to make sure that they have the training on it, they understand what those signs and symptoms are, and before they leave home, they kind of do a self-assessment. How am I feeling? Do I feel like I have a fever? Do I have a fever? Do I have some of those symptoms? And if they are sick, if they're not feeling well, ask them to stay home. So establish a protocol for employees who get sick at work as well. And those details should include how and where a person might be put in isolation. So if a person is sick when they come to work, or they get sick at work, you want to make sure that you're separating them and you are having them isolate before they can leave if they have to wait for transportation or whatever that might be. So make sure that you're establishing a protocol for those employees who come up and say, you know what, I'm not feeling well. I think I better go home. I've got a new onset headache and I'm having, some respiratory issues. You want to make sure that they're safely transported to where they need to. If they're in distress, then that may be calling an ambulance. If they are just saying, hey, I'm not feeling well and I'm going to go home, then let them do that. So use some judgment there. But then also, once someone has said, hey, I'm sick, and you've taken care of that individual and taken care of their needs and gotten them safely transported to where they need to go, be sure to establish and follow a protocol on cleaning and disinfecting the areas that the sick person occupied to help the spread, help eliminate or mitigate the spread of the virus. So if they've been in a workspace, you want to make sure that you are cleaning that workspace. And also, just as an employer, you probably want to be aware of the fact that you could be working with health officials on contact tracing, depending on the circumstance. I don't know that they call all the time when someone comes down with coronavirus, but they could, and so don't be surprised if that happens. They may call and want to know more information about where they were, and who they possibly exposed. So you want to make sure that it truly is a health official that's calling, and you want to get some kind of confirmation of their ID before you give out any health information. So be sure and do that too. Now, once an employee has been out and they have, followed the CDC guidelines for discontinuing that self-isolation, either after an illness or if they were in a quarantine, or just being monitored for after an exposure or something, make sure that you follow the CDC guidelines for bringing them back to your workplace, and make sure that they're also routinely monitoring themselves, or someone is monitoring them for the signs and symptoms of the illness at work. And that should be obviously in accordance with CDC guidelines. So in other words, if they're homesick and they get better and they have been home for the allotted period of time based on what their circumstance is, and they come back to work, you want to make sure that the monitoring doesn't stop. You want to continue to monitor them and have them monitor themselves just as they were before. So they need to be checking in with themselves before they leave for work. They need to be checking in with you when they get to work, those types of things. So controls, and what we mean by controls are really two different types of controls. They're engineered or physical controls that you're going to be doing, and then administrative controls. So let me talk about those. The physical controls, you want to select and implement appropriate physical controls. So what does that mean? That could be barriers or shields to separate employees, or to separate employees from customers as they come up to maybe a ticket area or come up to a reception area. If you can put those plastic shields to protect those respiratory droplets from being transferred from one person to another. Obviously, they'll both be wearing face masks, as that's the order here in Colorado, but you would still want to make sure that you've got some kind of barrier, if possible, to separate employees, or employees from each other, or employees from visitors. And then look at enhanced ventilation in the building. So what does that mean? Do you have to put in a new air conditioning unit? No, not at all. But if there are windows and it's nice outside and you can open the windows, that might be a good way to get some enhanced ventilation. There obviously are HVAC systems that you can look at, but I don't think for a small business that's a real feasible solution. So be thinking about other ways that you can make sure that the building is well ventilated, whether the use of fans or opening windows, or things that are affordable and within your control to be able to do for those physical controls. Now, on the administrative side, that's more scheduling, process, policy. So you may have staggered work shifts. You may have half of your workforce coming in one day, and then they stay home the next day, and the other half of the workforce comes in. You may have staggered shifts from an hour standpoint. Some people work from, I don't know, 8 to noon, and other people work from noon to 4, or whatever that might look like. So you might have staggered work shifts. You may have to schedule and time breaks where you never have before because of the break room capacity or the space within the break room to make sure that people can stay 6 feet apart. Have those kinds of conversations with your employees to make sure that they understand that that still applies even when they're on breaks. You want to make sure that you're practicing social distancing, replacing in-person meetings with video meetings as much as you can, so you're not having everyone in one room, but you're able to maybe hold meetings via Zoom or another video platform. Make sure that your face masks are added to your dress code policy. So if you have a dress code policy, you want to add face masks to that policy. Just as you can say, hey, you've got to wear a shirt and you've got to wear shoes and you've got to wear pants and you've got to do these kinds of things, and this is what we require you to wear for your dress code here at this business. You can also include face masks in that dress code. And then when face masks are no longer needed, which is a day we're all hoping for, when that happens, you can adjust your dress code at that time and maybe just say that face masks are optional, or you can say that face masks are needed only when directed by a government or a governing body, or by the state, whatever that might look like. Make sure that you're also providing and ensuring employees wear proper personal protective equipment in accordance with OSHA standards. So for many small businesses, that's not a consideration. You don't need the hazmat suits, you don't need the, those kinds of things. But you might need to have more of that type of discussion in a chemical plant, or maybe in some aspects of a manufacturing plant. So just if that applies to you, make sure that you're following that in accordance to OSHA standards. And then hold the employees accountable for following all these policies and procedures that you're making under these administrative controls. So you want to make sure that they're doing what you're asking them to do. Workplace flexibilities. This is one of those things that you can look at different policies and make changes to apply to the COVID-19 situation. So evaluate your current policies and procedures. Consider telework, working from home, sick or other types of leaves that might apply, and other options that are going to lower employees' chances of being exposed to the virus due to the workplace. One of the things that I wanted to cover today, two things actually. The first thing is the Colorado paid sick leave law. So right now, through December 31st of this year, all employers in the state, regardless of size, so if you have 1 employee or if you have 500 or more, they are required to provide each of their employees paid sick leave for reasons related to COVID-19 and the pandemic in the amounts and for the reasons specified in the Federal Emergency Paid Sick Leave Act. And that Emergency Paid Sick Leave Act is part of the Families First Coronavirus Response Act that came out in the early spring. So all of those, what that basically says is all employers are responsible for providing that leave that's required under the FFCRA, or Families First Coronavirus Response Act. Everyone is responsible for providing emergency paid sick leave under that act. Now, on January 21st of next year, so January 1st of 2021, employers with 16 or more employees are required to provide paid sick leave to employees. And that is accrued at a basis of 1 hour of paid sick leave for every 30 hours worked, up to a maximum of 48 hours per year. So if you have 16 or more employees, starting January 1st of 2021, you're required to provide paid sick leave to your employees, accruing at 1 hour of paid sick leave for every 30 hours that they work, up to a maximum of 48 hours per year. All employers, so employers with 1 employee on, have to provide this this paid sick leave effective January 1st, 2022. And that's the new Colorado law that just went into effect within the last several weeks. Now, the Family First Coronavirus Response Act, if you're not familiar with that, just wanted to cover that briefly. That's up to 2 weeks of paid sick leave at the employee's regular rate of pay if the employee is quarantined and or they're experiencing symptoms and seeking a medical diagnosis for those symptoms. So they get 2 weeks of paid sick leave at the regular rate of pay. Or there is paid sick leave at 2/3 regular pay if they're caring for an individual who's subject to a quarantine, or they're caring for a child whose school or daycare is closed or unavailable for reasons related to COVID-19. So be sure and check that legislation out so that you know exactly what you have to provide under the new Colorado paid sick leave law. And then be sure and communicate about these policies and options to your employees. So the Families First Coronavirus Response Act has posting requirements. So I want you to make sure that you're following those posting requirements, and you can find those easily online. Now let's talk about training, because I think this is really important. What do you want to train your employees on as they return to work? Well, you want to train them about their risk of exposure to COVID-19. Talk to them about what you're doing to protect them. So the steps that you're taking in your business that we have discussed so far today, and more that we'll discuss in a few minutes. And then how they can protect themselves as well. So that's self-monitoring, the way that they can do that. You should be training them on the wearing of cloth face coverings, so those face masks. Make sure that you're showing them the proper way to do that and demonstrate that. And then include your policies about face masks, again, that dress code that I talked about earlier. And also, especially maybe in manufacturing companies, have a conversation with your employees about face coverings and how they might cause or contribute to a work safety hazard, if that's applicable. So what you want to do is you want to make sure that they're not loose, so they can't fall into the machinery, the face covering. So those types of things, you want to make sure that you're talking about those safety protocols that you want your employees to follow if they have a risk of that face mask creating a safety hazard at work. And then also training on PPE. As I said, there may not be a lot of people that have to wear these suits that I have this picture of on the webinar today, but you want to make sure that you're including your OSHA and CDC guidelines if that does impact you. Talk about how to put on, use, and how to take off that PPE, and how to clean and maintain and even store it. And also, obviously, cover the limitations of the PPE and the limitations of what you're doing within your organization to help keep the employees safe, because a lot of it depends on, are they keeping socially distant? Are they washing their hands? Are they using hand sanitizer? Are they wearing their face mask? Are they following all those protocols? You know, they need to be doing that to help keep themselves safe as well. So be sure and train on that. Anti-retaliation. So we had a conversation about that, how this is one of those hot buttons for me. We want to make sure that employees understand their right to a safe and healthy work environment. And you want them to be safe and healthy at work. You don't want them to be fearful of work or afraid to come to work based on their concerns about something that is unsafe. So they should know who to contact if they have a question or concern about workplace safety in general, but certainly in light of the pandemic. And they should also have a clear understanding of your policy regarding retaliation. So, you know, you shouldn't be yelling at them on the phone if they're saying, "Hey, I'm concerned about my safety," or I'm worried that I have this, you know, I have a safety or a health concern that I want to bring to you. Your policy should clearly state that no retaliation is tolerated, and include specifics about retaliation for raising workplace safety and health concerns in your policy. Make sure that they know their rights, and part of that right is that they can raise workplace safety and health concerns and seek even an OSHA inspection under the operational Occupational Safety and Health Act. So they are available to do that, or they have the right to do that. And then make sure that your supervisors or anybody managing employees, team leads, or if they're managing employees, supervisors, obviously you as a business owner, make sure that you're familiar with workplace flexibilities that we've talked about, other human resources policies and procedures. Make sure that you've reread your handbook with regard to all of these things and updated that as you should. And then other workers' rights in general. Make sure that people managing your employees have an understanding of all of the employees' rights and the policies and procedures that you're using to manage those employees. So let's just go through a quick review of how to keep your employees safe. I thought about this and I thought bubble wrap, but it may be a thought, but I think it's better to keep the employees safe considering the CDC, OSHA, local health department, and even industry guidelines. So it is your job as a business owner to provide the safest working environment possible for your employees. You should be considering face masks, gloves and gowns in some instances. Make sure that you have policies for social distancing. Consider barriers or partitions and one-way traffic patterns, as we discussed, to prevent people from being closer than those social distancing guidelines of 6 feet. Make sure that you're improving your ventilation and conducting daily health checks. That's also another important way to keep your employees safe. So I'd like to spend a little more time on the health checks. Now, there are many things to consider when you're doing a health check on your employees. I think some of us have gone to places of business where I know that my temperature has been taken and I've had to say that I have not experienced any COVID symptoms and I haven't traveled outside the United States, and all of those kinds of questions that are being answered or asked as I go shopping or go to a doctor's office or go somewhere else where I am a customer. They're asking questions. So what health checks are recommended for employees? Well, typically checking the employee's temperature and asking them if they're experiencing COVID-19 symptoms are the most common. So those health checks should be done before the employee enters the building or right as they enter the building, and should be consistently done for all employees. So you're not going to pick and choose which employees you do it for. You're going to implement these health checks and do it for every employee that comes in the building. You should also keep the documentation on that information that you've obtained in the health check. You need to make sure that that's confidential, and we'll talk about that in a minute. And then also, let's talk about how you engage the employee in the health check, because having them just say yes or no is not really engaging them, and you want to make sure that you're engaging them in that health check. So what symptoms are you going to be looking for? Well, there are many lists out there of COVID-19 symptoms, and it seems to be changing rapidly every day as they discover more. And so I've picked a few that are the most common. A fever, obviously 100.4 or above Fahrenheit. Maybe somebody is feeling feverish, so that could be a symptom. A new cough. Some people have health conditions that they cough. If they have asthma or they have allergies or they have something like that, they may be coughing on a regular basis. And so it's not a new cough, but it's related to maybe another health condition. If they're having difficulty breathing, that could be anything from I'm having a runny nose, my nose is stuffed up, I've got some congestion, all the way to respiratory distress or respiratory issues. So you want to make sure that that is a symptom you're watching for. A sore throat. Muscles or body aches, which could include chest pains or headaches, those types of things you want to be sure to watch out for. Vomiting or diarrhea, and then a new loss of taste or smell. I'm hearing this is an early symptom, but people are talking about that. So this is not an all-inclusive list of the symptoms, but it covers some of the basic symptoms that I'm hearing most often. So you can look at those things. As you can see, when you're looking at all of these lists here, it could be not COVID related. We could have muscle or body aches because we had a rough workout. We could be, having a sore throat because we I don't know, we're singing and so our throat was sore, whatever that is. So you need to, you need to find out what these symptoms are and then make a determination as to whether or not you're concerned about them having COVID-19, or if it is, as I said, an existing cough because they have asthma. And make some determination there. We are not healthcare professionals. Many of us are not healthcare professionals, so do your best, and just use your logic. And if you have a concern, always go back to CDC and OSHA guidelines to determine what they say. If somebody comes in with a new cough and a sore throat, is that automatically they need to go home? There are some things that if they have a fever above 100.4, I would send them home. I wouldn't, they may have other symptoms and they may share those with you, but if they have that fever, that's one of those things that I would say, okay, I'm sorry, you've got a fever, you need to go home. Please call us and let us know how you're doing and check in with them. But there are some things that maybe, maybe it's explained away by something else. The other thing I wanted to touch on here was really engaging the employees in the discussion. So you can go into a place and they can say, here's the list of possible symptoms. Do you have any of these? And it's really easy to say yes or no. It's really easy to say, no, I haven't had any of those symptoms, right? It's recommended that when you talk to your employees, you have them review a checklist each day. And some people are even saying they should sign the checklist, either saying, yes, I'm experiencing some of these symptoms, or no, I am not experiencing any of these symptoms. So by signing that piece of paper, that's engaging them a little bit more into their thoughtfulness of, wow, am I experiencing anything? Because when people sign things, they have a tendency to be more thoughtful and to to have more of a thoughtfulness around that, and realizing they're signing something saying they don't have any symptoms. So if they have symptoms, they feel a little more uneasy about that rather than just saying no. The other thing you want to do is you want to make sure that you're filing that piece of paper in a confidential medical file. So make sure that happens, and we'll talk about that in just a minute. But it may take more time to do what I'm suggesting here, to having them, have those checks and actually sign a piece of paper, and then obviously filing that in that employee's confidential medical file. It may take more time, but it's also going to be keeping your employees safe. So a little bit of time to keep your employees safe and keep those employees who are experiencing those symptoms out of your workplace so you're not exposing other employees or even visitors or customers. So when you take the temperatures and do the health checks on your employees, make sure that you're documenting those findings, as I said. Keep that information in a confidential file. Do not share it with anyone who does not have a definitive need to know. These are Privacy Act and HIPAA protected pieces of information. So there are legal actions that can be taken if these pieces of paper are not handled correctly. Now, some of you may be thinking that many employees want to come to work sick. I think we've all done that. Oh, I have a cold, I can go to work sick. Oh, yeah, I've got a sore throat, but I'm going to go to work because maybe I'm afraid of missing work. I've got a project coming up. I want to make sure that I finish that. Or maybe I don't have any sick leave. It's important to emphasize with your employees during the training that they need to stay home if they are sick. This is not one of those situations where you want them to come to work because they think it might just be a little cold. You want them to stay home until they know for sure that they are feeling better and that it is not a COVID, they are not COVID symptoms and they don't have the COVID virus. So as we discussed under the workplace flexibilities section, the Federal Families First Coronavirus Response Act, or FFCRA, provides for sick leave for employees, and the Colorado's new Paid Sick Leave Act make sure that applies as well between now and December 31st. So let employees know about these benefits and how they can help that employee if they do need to miss work due to COVID-19. Now, if employees don't want to come back to work when you're asking them following a furlough, so you've laid them off, now you're returning people to work, make sure that you're having those conversations with the employees, discuss the precautions that you are taking to keep those employees safe, talk about all the things that we've talked about today, including those health screenings before employees come in, all of the safety measures you're putting in place with hand washing and sanitizers and social distancing and maybe barriers that you're putting up, all of those things. Be sure to talk to them about that. If the employee still refuses to return to work, they can do that, and that's fine. And a question that I get a lot is, well, are they going to get unemployment? If they're on unemployment, on furloughed, and then I ask them to come back, and they say, well, I'm not going to come back because I'm concerned about that. Do they get unemployment? And what I'm going to tell you, in Colorado, the Colorado Department of Labor and Employment has made it a little bit easier for the employer. First of all, it is required that in that instance, an employee who's furloughed has been offered to return to work and they're saying they don't feel safe. It is required that the employer and the employee both let the Colorado Department of Labor and Employment know that that's the circumstance, that they were furloughed, they're able to come back, but they're saying that they don't feel safe coming back. The state then will determine under what circumstances the employee will or will not continue to receive unemployment benefits. So it's out of your hand as a business owner. There's no way that you can make that determination. The state is going to make the determination on a case-by-case basis. So that's good. That's not something that we have to determine. The state will determine that for us. I wanted to take just a few minutes to talk about the stress that employees are under with this whole pandemic, and I'm sure that you're feeling it too. I know I am. We've got a 14-year-old who is doing remote learning now. We've got two entrepreneurs in our household, so we work out of our home, so everybody's on top of each other, and that adds stress certainly to a home. And there are situations where people are in home situations that maybe there's not enough space, and so literally everybody's on top of each other, and they're feeling a lot of stress. They're not sure if their child's going to be doing well in school. They're not sure if they can continue with their business because of the closures or the problems that they're having financially because they're not able to sell as much as they needed to, and they're missing their sales goals and all of those things. So lots of stress can be happening around the household. So when your employees come in, they may be feeling that stress. They probably are feeling that stress. So be sure to talk to your employees about their feelings, see how they're doing, and be an active listener in the conversation. Sometimes all they need is someone to just hear them. They just need to be able to talk. So we don't want to turn into therapists. That's not what we do as business owners in many senses. But we certainly want to be there for them if they just need to say, I really had a rough night, and homework isn't going well with my kids, and I just my spouse's business isn't doing well, and I'm just having a really, really hard time. Hear them out and help that employee stress by allowing them to vent. Be understanding. Be sure to refer them to an employee assistance program if you have one of those, or health insurance for their mental health coverage. I know that every county has a mental health department. There are phone lines that have been started for people who are feeling stressed, so be sure and have that information readily available. Help them with their stress as much as you can. You're not expected to be a healthcare or a mental health professional. What you're doing is just listening and identifying that they may need some professional help, and so have resources available there that you can give them. And then the last thing just is clean the work area often, and that should go without saying. Train your employees how to do this, as I mentioned earlier. Check in with them and make sure that they're doing it, and make sure that it's being done properly. So as we talked about, if someone becomes ill at work, just wanted to review that. You want to isolate that employee from other people. You want to send that employee home safely. Make sure that you're cleaning the potentially exposed work area immediately. Again, you want to keep the name of the employee confidential. You may need to tell other employees if that happened, that they have been exposed to COVID-19 at work, but you do not want to mention anything about the employee's name. And then make sure, we're talking about stress just a minute ago, make sure that you're following up with that sick employee to see how they're doing and what's going on with them, and make sure that they know that you care and that they're a valuable part of your team, and that you miss them, and provide them with as much support as you possibly can. And then just one more slide before we go to questions here. There are many things to consider when the employees are returning to work in the middle of a pandemic. One of the things that we have found from best practices standpoint is to determine a go-to person for COVID-19 questions. This should be a manager or a business owner. They should have a complete understanding of the processes, the procedures, and the policies for COVID-19 within the organization. So they should really have all of that information and be able to answer the questions. They should also be someone who can be trusted with confidential medical information, as honestly, employees are going to walk up to them and say, I'm having these symptoms, or I have this underlying condition, or whatever. So they need to be able to hear that information and not be spreading it with anyone else that does not need to know. So be sure to pick the right person to be the go-to person for the COVID-19 questions. And then educate your staff on COVID-19 facts and prevention tips. Have signs around the office on mask wearing and social distancing, hand washing, using hand sanitizer, the processes of cleaning the work areas. You may want to have signs around that. You want to have training around it, certainly, but there may be certain areas where you want to put some signage up as far as what they need to do, like a checklist or something like that, that they need to do periodically, either throughout the day or certainly once a day. You may be able to mitigate their risk of catching COVID in the office, but arm them with COVID-19 information, the latest and greatest information, to help them mitigate that risk when they aren't at work. So you've got control over the work environment. When they're out of work, you don't have control over what they do, but give them the best information so that they can make the right choices when they're out of work, and they won't be, they can mitigate their exposure when they're not at work. Make sure that you also talk to your vendors about your processes and procedures. So, let them know about potential health screenings if they're going to enter the building. If they're bringing packages and you don't want them to come into the building, let them know where to leave those packages and how to notify you of the deliveries. If they're not coming in the building, what should they do? How should they notify you? And then last but not least, and this is probably the main point throughout all this information, last but not least, follow your local, state, and federal laws regarding COVID-19. As I said at the beginning of the course, they are changing daily. So set an alert in Google or your search engine to be notified of changes in information that impacts you, your staff, and your business. Make sure that you've got the latest information and you're up to date. So thank you for joining today to learn more about the returning to work during COVID-19. I hope this information has provided you with the general information about returning to work safely during a pandemic. Make sure that for more information on how to return to work or employee safety during these unprecedented times, you're referring to the resources we discussed today, or be sure to contact the North Metro SBDC team for more information and assistance. And I just am really happy to have been able to bring this information to you today. Hannah, I don't know if we have any questions, but if we do, this would be a great time to take them. We have a few minutes before the course ends.
Great. Well, thank you so much, Courtney. This was really thorough and helpful information. A couple questions did come up. One is, if an outbreak or infection does occur with an employee, how should a business handle that messaging to other employees and also to customers, to the outside world? How should a business let them know about that, or do they need to let them know?
Yeah, so if an employee is suspected or confirmed to have COVID-19, the CDC, and there's a CDC resource that you can go to, and you can just Google, actually, employee has contracted COVID-19. What do I do? And you'll get some great resources. But be sure, how to take action. In most cases, what you want to do is you want to clean and disinfect the area to minimize the potential for other employees being exposed to respiratory droplets. So you want to take care of that immediate environment, right? And you want to get increased circulation to those areas to make sure that you've got ventilation. So maybe opening windows if possible, and getting some getting some air circulating through there. If for some reason it's been 7 or more days since the sick employee used the facility, um, the routine cleaning that you've done is probably okay. The CDC has cleaning and disinfecting recommendations. As far as having conversations with your employees, you want to inform the employees of the possible exposure to COVID-19 in the workplace, but maintain that confidentiality as we talked about. There are public health recommendations for community-related exposure. So if they, follow those as far as customers go, it depends on, obviously how long they were in the business, how long they were exposed to that person, and there are guidelines that you have to follow regarding that. So make sure that you're following those safety guidelines that we talked about. When you talk to the employees, you want to say something generic like, it is possible that we have been exposed to the coronavirus, and so we need to watch watch our symptoms, those kinds of things. You do not want to use the employee's name, but you do want to say that there's a possible exposure.
Great, thank you. That's really helpful. Yeah, some tricky waters to navigate, but that makes
It honestly is, Hannah. It's one of those things that you don't want to incite panic, but you do want to let them know that they may have been exposed. And as far as notifying those clients and those customers that may have had a long time exposure, so there, I think there's some minute guidelines. I believe it's 15 minutes of close exposure to that person could be considered an exposure to the coronavirus. Just again, go back to the CDC and the OSHA guidelines and find out exactly based on your situation what you should do with notifying the customers that came in. And then, as I said, health officials may be contacting you regarding contact tracing. And so obviously give them as much information once you verified they're legit.
Great, great. Thank you for that. Another question, would you recommend setting up a policy for employees who may be traveling, say, out of state? You mentioned, we can't control everything that employees do outside of their working hours. We can give them the best guidelines to keep themselves safe when not at work. But when traveling and maybe increasing their opportunity for exposure, would you recommend setting up some kind of policy around that?
Honestly, I would. And I think that what you would want to look at is maybe can they work from home for a period of time once they return from traveling rather than coming straight to work.
Mm-hmm.
And so I would be considering those types of things and talk to the employees about it. And then when someone is leaving town, letting them know, okay, we understand you're going out of town for a wedding or whatever that might be. So when you come back, we're going to have you work from home. Talk to them about those work from home policies that you have. Visit with them about what that looks like and about how long you want them to do that, how long you want them to work from home before they can come back to work. And
Great.
just use the CDC guidelines in those areas.
Good, good. Very helpful. Another question came in. As guidelines change and evolve, what is the order of priority between OSHA, CDC, the governor, etc.?
Okay, what a tricky question. So I don't know that I can necessarily say the order of priority between all of those entities. I think what I would do as an employer is look at what is going to protect the employee most and follow that, right? So if I'm going to use a made up example. If one of those agencies said you only need to be 4 feet apart for social distancing, and one said you need to be 6 feet apart for social distancing, err on the side of caution and go with 6 feet. So what I'm saying is you want to err on the side of caution, and you want to do what is going to what is going to help your employees the most.
Sure. Great. Yeah, that's a good way to think about it, to keep that in mind always. Definitely. Great. Well, it looks like those are all of our questions for today. I know we're pretty close to our time. Is there any last words you want to give to the audience, Courtney?
I just want to say thank you for participating today. Great questions. And again, if you need any more information, be sure to contact, the North Metro SBDC, the SBDC team, or if you're not in this particular area, your local SBDC consulting team. And then the other thing that I would say is, again, be sure to be checking on changes from the CDC, from OSHA, from local health authorities, and from the governor regarding these regulations, because they are changing. We're finding out new things. Things can change with the virus and exposures and those types of things. So be sure and be checking that on a regular basis to make sure you're up to date with all of the policies and procedures you're implementing in your business.
Great. Yes. Thank you so much for that, and for all of the really helpful information and resources, Courtney. We really appreciate it. And thank you to all of you for tuning in and for your participation. As Courtney mentioned, if you have other questions or would like to set up a free consulting appointment, you can do that at our website, which is northmetrosbdc.com. They're all happening virtually right now, so no need to worry about any of that exposure or those things that we discussed today. Very safe. So take advantage of that. Again, they're free. And again, that is northmetrosbdc.com. So thank you, Courtney. Thank you, everyone. And we wish you a great rest of your day.